Hello, my name is Nicole Erickson, and I am a student at Fort Hays State University, but I am also a nurse in the oncology department. And I have a presentation for you today regarding delays in cancer treatment, and it's an educational presentation about a change process that we are going to be making, hopefully here very soon at Gordon Hospital. So the objectives of this presentation are that you, the providers, will be able to demonstrate the ability to comprehend the information presented by being able to summarize the current cause of treatment delays. You will also be able to demonstrate your ability to apply anything that you learn here to solve problems by implementing this in your practice, and refer to the Lung Navigator when appropriate to reduce treatment delays. You providers will also be able to demonstrate the ability to comprehend the information presented by making a change in your practice and begin educating patients who meet certain criteria and explaining how they may be eligible for a low-dose CT screening, which would be paid for by their insurance company. So why is this topic so important? I think every single one of us knows someone who has had cancer or someone who's had a family member that has been diagnosed with cancer and gone through this awful disease. And so lung cancer in specific is the number one cause of death and cancer-related mortality in this country and worldwide. Only 18% of lung cancer patients have a 5-year survival rate because of so many patients already having advanced stage disease by the time they are diagnosed. So it is really important for this population that screenings are increased and improved while preventing delays in treatment. Earlier detection may lead to a decrease in mortality, and today most lung cancer is not diagnosed until the patient begins having symptoms such as a persistent cough, pain, or weight loss. And unfortunately, once these symptoms occur, the patient is typically in the end stages of the disease. So I have a pre-test for you all to take today, and I'm just going to throw some information out at you just to see, just kind of for fun, to see what you know. And there is a picture of Starbucks drinks there because whoever gets the most points, most questions right on the pre-test, and there also is going to be a post-test, but whoever can get the most questions right, I will be giving a Starbucks gift card to. Just to keep you interested, because I know nobody wants to take tests. So the first question is, how long does the average lung cancer patient at Gordon Hospital wait before receiving their first cancer treatment? The second question is, describe the current process for patients being diagnosed with lung cancer here at Gordon Hospital. Third, what is the Lung Nurse Navigator at Gordon Hospital? Do you know what this nurse does? And last, true or false, patients who meet certain criteria may have a low-dose CT scan paid for by the insurance company because it is a preventative measure. And I kind of already gave you the answer to that one, so that's kind of a freebie for you. So the change topic that I am introducing here to Gordon Hospital is that the nurses who work in the oncology department noticed that there was a lag in treatment specifically for our lung cancer patients. These patients are typically seeing their primary providers, which is you, due to symptoms, and many of the patients are having symptoms like we talked about before: persistent cough, weight loss, they're just not feeling well. And so they're coming to you to find out what is wrong. So then you, providers who suspect that the patient has lung cancer, are then referring these patients to see either a pulmonologist or an oncologist. And currently we do not have, as you know, a pulmonologist here at Gordon Hospital. And so these patients are having to go outside of our network to see this type of specialist. And pulmonologists, as you all know as well, can take a long time to get in to see. Typically, on average, around 30 days before patients are seeing a pulmonologist. And then, after seeing a pulmonologist, then the specialists are sending the patients to have diagnostic testing completed. And this change topic is hopefully to reduce the current delay of 60 days until treatment to 45 days over a 6-month time frame. So the Lung Navigator that we have at Gordon Hospital is a specialized nurse specifically designed to work with our lung cancer patients. And so our patients who are suspected to have lung cancer and need a biopsy, so in changing from them being sent to a specialist, we want these patients to be referred to the Lung Navigator. Because from there, she would be able to aid you in tracking the patients through the system from their initial symptoms to diagnostic testing and finally entering into treatment. The Nurse Navigator is able to initiate diagnostic testing by developing a set of standing orders with the primary provider clinics. So she would meet with you, and any standing orders that you felt comfortable allowing her to initiate, such as lung biopsies or any other testing that could be done through our interventional radiation department or radiology department, she could set that up and get the patients in for testing right away. She would set up these appointments for the patients. She would follow up on test results, and then she would notify you as soon as those test results were back. That would also potentially decrease any sort of lag, because she's going to be looking for these test results, shortly after the test has happened. And then she can notify the patient. She can also set up appointments with specialists at that point. So if the patient does have something suspicious on a biopsy or any sort of diagnostic testing that they have done, she can then collaborate with you, the providers, and set up an appointment with either the oncologist or the pulmonologist if that is needed. So this would all help aid in the process for starting the patient's treatment quicker. And today, most insurances are paying for patients who meet certain criteria to have low-dose CT scans completely paid for, because it is a preventative measure and a way for early detection of lung cancer, which is the number one way for us to improve mortality rates for these and life expectancy for these patients, is early detection. So the NCCN guidelines suggest that the patients between the ages of 55 to 77, they currently smoke or have quit within the last 15 years and have a 30 pack year smoking history should have a low dose CT scan. Or if they're over 50 years of age or older, they have a 20 pack year smoking history and one or more risk factors such as COPD, family history of lung cancer, etc. These are the patients who would be eligible for having the low-dose CT scan paid for by their insurance company. This information is also hopefully going to be added to all of the ad boards that we have throughout Gordon Hospital and in the clinics. The oncology department would like the primary providers to begin referring patients to the Lung Navigator who fit this description, and hopefully having that ad up in the ad boards at the clinics, the patients will be seeing this, and if they recognize that they meet that criteria, or they know someone in their family or their friends who meet that criteria, they can let that person know, or they can contact you, the providers, or the lung navigator. So I have a bunch of literature that suggests why this topic is so important, and why we should be reducing any delays in treatment. There was one study that was done in Denmark that suggests while there has been improvement in prognosis for patients with lung cancer, there is still a long road ahead to improve treatment and life expectancy. A delay in diagnosis and treatment for lung cancer patients can be a factor in the poor prognosis for this population. In Denmark, the delay between referral and diagnosis, and from diagnosis to treatment, is a well-known and well-researched phenomenon. This study showed that transfer of patients to other facilities for diagnosis and treatment led to significant delays in treatment and poor outcomes for the patients. Another study was done in Brazil, discovered that patients in metropolitan areas waiting for 1.5 months from diagnosis to treatment. Also, within this study, there was a delay in patients being diagnosed from the onset of symptoms to diagnosis, sometimes being as long as 90 days. And another interesting point from this study was that those living in densely populated areas actually had longer wait times to see a specialist, such as an oncologist. And hopefully, because we have a smaller community here in Gordon County, we can get our patients in to see specialists quicker, because we're a little bit more rural of an area. So another study there was a recent review of 693,554 patients diagnosed with non-small cell lung cancer in the United States from 2003 to 2011, showed that shorter wait times were associated with a decreased risk of death in early stage patients, but poorer survival rates in patients with advanced disease. According to this article, most diagnostic interventions should not exceed 2 weeks, while various treatments should be started within 4 to 8 weeks' time, depending on the type of treatment and stage of the disease. It is noted within the article that most countries are not adhering to the recommended guidelines. And one last study, done in Ontario, found that wait times from referral to diagnosis was 21 days. Then another 56 days until the first treatment, and following that, it was 70 days until patients went to surgery. The need to properly utilize the lung nurse navigator to aid in fast-tracking the patients through the system was noted. This study in Ontario found that for organizations to adhere to the recommended guidelines for wait times, that a diagnostic assessment program be implemented. This enables patients to have diagnostic testing done promptly and effectively, reducing delays. So why implement this change? Why change the way we're doing things and create a new way? So at the 2017 American Society of Clinical Oncology meeting, there was research presented that a greater effort needs to be made to decrease treatment delays in cancer patients. The oncology director and the medical and radiation oncologist would like to see a reduction in wait times for their patients. Patients with lung cancer have an increased risk of mortality from 1.2% to 3.2% per week of treatment delay. Comorbidities must be accounted for with this number as well, but that is a pretty significant amount if you think about if their treatment is being delayed for weeks and weeks. So the goal would be for the lung navigator RN to help the providers and have a fast track system of eliminating the referral to a specialist when that's possible, and move the patients into diagnostic testing as soon as possible. The lung navigator would then be able to track all the patient's movements through the system. She would also be able to, like I said before, initiate biopsies and other diagnostics through the interventional radiology department while helping providers coordinate patient scheduling and setting up appointments with the radiation oncologist or medical oncologist. So this problem can also be measured by seeing if there's any sort of decrease in the time from onset of symptoms to diagnosis to the start of treatment. The nurse navigator can also evaluate if there is an increase in the number of patients receiving lung cancer screenings, because this is something that she already currently is monitoring. And lung cancer is the most frequently diagnosed cancer and has the highest rate of mortality among all other cancers. An increase in tumor size and cancer stage has been noted when patients experience a delay in diagnostic testing and treatment. Ultimately, through this change, the lung cancer patients at Gordon Hospital will be treated in a timely manner that adheres to NCCN recommended guidelines and improves the quality of life and life expectancy for this vulnerable population. So why is the Lung Navigator so valuable? The benefits of a nurse performing the role of the navigator include the skill to clinically assess patients, provide support and education, manage the complexity of the patient of the cancer diagnosis, and communicate and collaborate with other clinicians. Additionally, the oncology nurse in the role of navigator has the ability to proactively anticipate patients' needs, initiate appropriate referrals, and provide valuable education to equip patients with knowledge and understanding, thereby reducing anxiety and stress, which allows patients to feel more in control of their situation. So that is the end of my presentation, and as I promised, I have a post-test for you. So the first question is, how long does it take to get the lung cancer patients to start their first treatment? Second, list the criteria for patients to be considered for the low-dose CT screenings paid for by insurance. I'm also going to be handing out cards that has all of this information on it for you so that you can keep it right there at your desk, so that if you have a patient that comes in who meets these criteria, you have it right there to look at for a referral. And also, third, last question, describe how utilizing the Lung Navigator can enable the patients to be processed through the system with ease and minimal delays. So that is the end of my presentation. Thank you very much. Here is a list of some of the references that I used for developing my presentation. And I really hope that through collaborating with you providers and the administration and the oncology department with our radiation and medical oncologists, that we can really improve the outcome and quality of life for all of our patients. Thank you so much. Have a wonderful day.